So what about the dental profession itself? And I do want to put a slight word in for the dental profession, and this is particularly relevant when we get to module 3 because it's a tough profession. It's not a good profession for one's health. This comes out every few years. It's the US Department of Labor looking at 974 occupations in the database, and it looks at exposure to contaminants, disease and infection, hazardous conditions, radiation. There are very few risks of minor burns, cuts. Yes, definitely there are risks of that, and needle stick injuries and time spent sitting. Mind you, this does not factor in stress, and stress is an important part of the dental experience. I'm putting this out there to give you a perspective of the dental profession as well. Why doesn't the dental profession identify this? It's a very stressful job. And just to give you an indication, here are just some of the top 47 worst jobs for your health. And I put these because to put them in context, I don't think many people, want to work in a metal refinery, although thank goodness for those that do. Plumbers are a risk, but not as bad as you might think. Similarly, garbage collectors, pilots, yes, that's not a great job. But here we start getting into what may be surprising, and for dentists, what is perhaps the most worrying. Numbers 1, 2, and 5 are in the dental surgery, and we haven't even factored in stress. Look, for over 40 years, this has been my practice, and we are a patient-centered practice linking oral health to general health since 1983, when we coined the name Sydney Holistic Dental Centre, and we invite people to come in and share our views. These are the views from our surgery, but it's the views on healthcare that are important. And we've been talking about this since 1983. So when I saw this article come out in 1996 linking gum disease to all of these conditions, I thought, wow, the profession is changing, and the profession definitely is changing. Whether a dentist calls themselves a holistic dentist or not, they know gum disease is linked to these conditions. And if gum disease is, so can tooth decay or other infections in the jawbone. And they also are becoming aware of the link between sleep and breathing and the shape and size of your mouth. And not to forget this report that came out in 2024 or 2022. So philosophy of practice is really important. I'm including this for any dentist or health practitioner, but if you're a patient or from any practice, I think this kind of question is a really important one for you to consider. Why do we do what we do, and how do we do it? How do we do it? That's right. What is the philosophy? And this is an important statement because I believe it's the way we should be working. This is a mission statement that we've had in our practice for over 30 years. A practice is patient-centered, treating every patient and team member with care, respect, support in a relaxed and comfortable environment. Our aim is to provide optimal oral health care to enhance our patients' general health. Our team will provide high-quality, state-of-the-art care and advice which is relevant to our patients' need.